Marissa. I'm one of the psychological wellbeing practitioners and I work at Harrow Talking Therapies.
Hi, I'm Asal and I'm also one of the psychological wellbeing practitioners and also work alongside Marissa at Harrow Talking Therapies. So there's two ways that you can be referred to Harrow Talking Therapies. So the first way is through your GP, where if you visit your GP, they'll be able to fill out a referral form and send that to our service. And the second way is via an online self-referral that we have via our website. And if you fill that self-referral form in, you can then send that to our service and we'll receive that. And we will also put the website of our service at the end of this video. So in Harrow Talking Therapies, we offer two different types of treatment. This can usually be discussed with you at the end of your assessment. So the first type of treatment is cognitive behavioral therapy, also known as CBT. So cognitive behavioral therapy is a talking treatment that has a very clear focus, and your therapist will work with you to focus on your specific difficulties that you're currently experiencing, and it will focus on the negative thoughts that you're having, and as a result, which will cause negative behaviors. And your therapist will work with you in a very collaborative manner to help change those negative thoughts and behaviors. And cognitive behavioral therapy usually can be offered either face-to-face or via an online program called Silver Cloud. This can be discussed with your therapist in your assessment again. And the second type of therapy that we offer is counselling. So counselling offers you a space to reflect, to make links, find support and validation, and talk about current and past difficulties. And counselling is less structured compared to cognitive behavioural therapy and less goal-orientated. And it usually doesn't offer you advice, but just a space for you to reflect. And we also do offer wellbeing groups if we think this is the appropriate option for you. However, this can be discussed with your therapist in your assessment. Usually within Harrow Talking Therapies, we offer treatment more on a short-term basis, and this usually can be between 6 to 10 weeks, depending on the type of therapy that you're having. This will be discussed with you in your assessment again. And we also do have a midpoint review usually within our treatments to see if you might benefit from an extra session or two, or if you might not need the full 6 to 10 sessions. So within Harrow Talking Therapies, we work with a range of different difficulties. This includes anxiety, depression, OCD, health anxiety, phobia, panic attacks, bereavement, and many other difficulties. And again, within your assessment, your therapist will go through a series of questions where they can see what might be your difficulties if you're struggling to know what it is, and we can conclude what might be the best treatment option for you based on your difficulties. So usually we recommend to have weekly sessions for the therapy, as that's been shown to have the best outcome for the patients and clients. However, we do understand sometimes weekly sessions might not be the best option. So we do also offer it on a bi-weekly session as well. So Harrow Talking Therapies usually is open between 9 to 5, Monday to Friday. And we do also run some evening clinics. So should the 9 to 5 opening times be not appropriate for you to do treatment sessions, the therapist can discuss evening clinics with you.
We would normally recommend a 3-month consolidation period after you finish your treatment, and this will just give you a chance to practice the tools and techniques that you've covered in the session. You then have the option to re-refer to our service if needed. If necessary, towards the end, we can also consider signposting you to additional services. Another option might be that we can set you up on our online CBT program, Silver Cloud, which contains different modules on low mood, anxiety, and stress. In some cases, when treatment finishes and your therapist feels you may benefit from further support, then it may be possible to step you up from step 2 to step 3 so you can receive further support. So your therapist, once they're allocated to you for treatment, they'll be in touch with you first just to book in that first appointment. The ongoing appointments will then be booked at each session. If for any reason you can't attend a session or you need to reschedule, then it would be your responsibility to let us know. Yeah. It depends on the type of therapy. So for example, with counselling, there isn't really much you would need to do between the sessions, but with cognitive behavioural therapy, it does involve in between session tasks. And this is something that is set up at the end of each session. So with these in between session tasks, it just gives you an opportunity to try out the techniques in your day-to-day life and see how well they work for you. Some examples might be that you keep a worry diary or a thought diary, and other times it might be you're actively practicing a technique or a strategy that you've covered in the session. So our service policy allows for up to 2 cancellations, non-attendances, or rescheduling of appointments. So if a client was to miss this for a 3rd time for any of those reasons, then we would have to discharge you back to the care of your GP. The only reason being is that it's important there is that continuity with treatment, just so it's most beneficial for you. And the evidence suggests that if there are long periods in between sessions, then it's unlikely to be very effective. Yeah. Primarily, your therapist will be involved with your care. Also, the GP may be kept aware as well. So if there were any concerns relating to risk, then we would correspond with them. Also, your therapist supervisor, although they're not directly involved, they will be there for your therapist to discuss all cases with. Although you can't choose your therapist, you can let us know if you have a preference for either a male or female therapist. And if you would like to also request for the same therapist that assessed you, you can do so as well. We can try and make that possible. If, however, you start therapy and you feel perhaps the therapist you've been allocated isn't right for you, then of course you have the right to let us know and we can sort of offer you to work with someone else. Yep. So if you have to transition, then CAMHS can either refer you directly or you can self-refer, or the GP can refer you on your behalf. So if you're coming up to the age of 16 to 17 years old and they feel you might be suitable, so in other words, you might be experiencing a mild to moderate mental health difficulty, then CAMHS will refer you directly to us. If there is more sort of complexity involved, or they feel that longer term work will be more beneficial, then they will continue to support you until the age of 18 and then refer you directly to the community mental health team.